Hi, everyone. Welcome to Healthy State of Mind, a series all about mental health and wellness, hosted by Dr. Tracy Murray and myself. My name is Caitlin Heckel. I'm a digital content specialist here at Ochsner Health, and today is our Q&A episode. This is our second episode in the Q&A series, so go back and watch the first. But this is a series and an episode where we take your questions and we answer them right on the spot.
Right on the spot.
So we have a stack of them and we are ready to roll. Okay, you ready?
Yes.
Nice. Okay, so the first question is, how do you cope with depression without medication? My husband says that I should just work out and go to the gym instead of going to therapy.
Oh, you started off just wild.
Wow.
We're right into
I have thoughts, but I'll let you answer that.
So that's a multi-tiered question because therapy is separate from medication management. They do work great together. But in certain circumstances, you can have one without the other. Some people respond to one and not the other, a combination of both or neither. I would say that working out can be very successful for some people because cardiovascular activity is actually burning off the stress hormones and helping the hormones that make you feel better to release. Okay. But if what you're dealing with in terms of depression is above and beyond your ability to even get to the gym, sometimes there's depression where you can't even get going. There's nothing there. There is a block. For those people who are experiencing that in that way, may need a jump start with the medication, right? For some people who have the medication, have maxed out on it, maximized it to its full capacity and still can't quite get going, then we say they need therapy. Oftentimes when I'm seeing people, since I'm a psychologist, I don't prescribe, but everyone who's a psychologist, counselor, or social worker should have the ability to be aware when someone is in need of a medication because there's something chemical going on. So if I'm working with you in therapy and we're utilizing techniques and you still just can't get going, I'm like, all right, this person is too anxious to even engage with me, or too depressed to even see and have the cloud lifted up, then that lets me know they may need to be tried on a medication. Okay. But yes, sometimes exercise works for people. But if you try that or can't even get going, then we need to try something else. Okay. Does that answer that question?
It does, I think.
Does. That's a lot. That was a strong one coming out. Have a talk with your husband, first of all.
And okay. Also, there's nothing wrong with taking medication.
There is nothing wrong with taking medication, people, because when we think about it, how I like to explain, everybody, tell me if this dates me. Pac-Man? People play Pac-Man?
I love Pac-Man.
All right. If we don't go with the Pac-Man theory, then I just don't know what else to say. Okay. Imagine playing Pac-Man, right? Pac-Man's eating little bubbles, right? Imagine that your bubbles are serotonin and or norepinephrine. Your Pac-Man is your receptor. Of course, this is just a very simple way of explaining it. When you have an undue amount of stress that comes on you, when unmanaged depression, some people are born with this predisposition. Your Pac-Man is just spinning. Do, do, do. That was a good one, right? It's just really spinning, right? It can't eat what it needs to. That medication is just letting the Pac-Man eat, absorb, push out into the rest of your brain what it needs to. Sometimes people are born with that. Sometimes people have a predisposition. Sometimes people have such a great amount of stress on them that changes. Sometimes people have a medical issue where that changes. Sometimes people just have it change. So I don't want you to see medication as, oh no, I'm not going to do that, when there may not be anything else to do but that. Like vitamin D. You can eat the food, you can go out in the sun, but you might be predisposed not to be able to have vitamin D and take it in like you need to. So you got to take a supplement, right? Think of it in that way. Disassociating the stigma from the medication as, oh, she take crazy meds, when it's not about that. It's a relation of chemical exchange. But that's only half the battle. Right. People think medication will take care of everything when that's not necessarily so. You can take all the meds and still be at home not doing anything about your depression. We got to establish goals. We have to get you out there. We have to set up a routine. We have to make sure you're fulfilled and involved and you're managing anxiety, managing the thoughts. That's the therapeutic part. not the medication part.
That's a perfect segue because our next question is, can anxiety be successfully managed without the use or need of medication?
Yes, it
How?
can be with skills, skill development, stress management skills, techniques, thinking about thinking, what to do with your anxious thoughts, what to do with your body. When we do these many mindfulness moments here, those are strategies and techniques to get control of the body, right? So yes, it's absolutely possible.
Okay. And then going back to meds, how do you know which type of medication will work? Like what's an SSRI?
An SSRI, like that Pac-Man,
Right.
It's a selective serotonin reuptake inhibitor. So
Okay.
it's basically your serotonin is not moving through the brain, right? Something's blocking it. So that med is to stop the block.
Got it.
Right? Stop reuptake from happening or get sucked back in.
Oh, okay.
How do you know which one will work? Talk to a professional. Typically, a good place to start with is your primary care doctor. Many people can prescribe simple medicines, but in certain cases, there are new tests that you can require if you fail, what we call failing out of medication. So some people, this one doesn't work or they have stronger side effects. You can ask your doctor for a blood test to see which one can fit for you better
Okay.
based on what your DNA is looking like in your genetics.
Yeah. Perfect. Okay. Next question. What do you do if you feel like you've reached your limit in life and nothing will get better?
First, I would say, what does better even mean? We'll start there. Does better mean what it was before? Does better mean something different? Is better a trap? There's this wonderful book called The Happiness Trap where I read to certain patients who feel exactly this way, where they're saying that happiness is a trap, that even in the each day you're missing stuff that is better. Not because of function of what you're not doing or what's not going on. Your perception is clouded. I can't see anything without these glasses. Your perception and view of the world is clouded for various reasons, anxiety, depression, stress, and so forth. So your ability to even see better may be clouded. So what's better?
Yeah.
How you do that is talk with somebody, right? If you don't have support, you talk with a professional. There's nothing wrong with that. It can be quick, short-term things or much long-term things, or just reading up and just looking within yourself about what better means and not being aware of what you're doing now, right? We could look at the day and we're like, God, I got so much to do. But what have you done? What did you do that day? You did something. Even if you turned on this show, that's something.
Yeah.
Because you're becoming aware. Even the person asking that question did something. Know how strong it is for someone to ask that question,
Yeah.
right? So whoever asked that question, kudos to you, that you did something better for yourself.
Oh my gosh, that's making me emotional. Okay, kudos to everyone really who
Yeah,
asked questions.
thank you for
It's so
these
brave.
questions.
Yeah.
Yeah.
And I mean, I feel like we're all kind of on a never-ending self-discovery journey.
I don't want you to ever find it, right? These things that when we think about the theory of Maslow's hierarchy of needs is self-actualization. I want you to always be actualizing towards a better you. That's what you're here for.
Yeah.
So if you feel like, gosh, I've attained this, what is the thing that you want to reinforce? That's values-based living if we're thinking about acceptance and commitment. Am I living my life according to what I value? If you're not, then why are you doing it?
Yeah.
I mean, we got to pay bills, right? We got to go to work. But those other things, it should not be so off balance. That's when you feel off, right? It's when you're not living life according to those values. So that's when I go back to what is better, what is happy. I don't know what that is. Let's explore that.
Yeah. How do you deal with loneliness?
Oh, I think we have maybe a whole episode on depression, loneliness. What was it? Christmas time blues or
The holiday
blues, right?
Yeah.
Sometimes loneliness can be defined or in several different ways. Is it emotional loneliness? Is it physical loneliness? Because you can be with someone physically and still feel quite lonely. So what is the loneliness? And I would say, all right, I'm lonely emotionally. Then you intentionally seek out things to fulfill that loneliness. like those values-based goals. If social interaction and being around people intellectually or talking about thinking is what you lack, then you seek those things out, right? How you seek them out can vary from place to place. But loneliness is a loaded question because I need to know what kind.
I can ask something that came to my mind.
Sure.
So I know that a lot of people my age, I'm in my 30s, and then as we grow older, it seems like life can become smaller and circles can become smaller. So do you have advice for people in their 20s, 30s, 40s, 50s to combat loneliness by making friends? But how do you make friends?
Right. So I often think of relations like a bullseye. If you think of different theories, it's like a bullseye. So in the inner part, there are several rings, and then that solid red part, right? That solid red part are your people. Not everyone is going to be there, and that's okay. Sometimes people think of relationships and friendships as in or out. Doesn't have to be that way. I think that's one of the catalysts for loneliness. They're either in that inner circle and your people, or they're not. When I don't want you to think of it that way because you're missing the rings. The next ring might be people. They're not in your inner circle, but you talk to them here a couple of times a month. You can go out, have a good time, but it might not be deep. They may show up for you. They may not. Know where to classify these people. Next ring. People you see here and there. It's back like you never left. You can have a good time with them, but it's not deep. And then on the outer circle, neighbor, stranger, people you see here. You need all of these people. All of these people in the term of the bullseye example matter in the context of human interaction, and loneliness. Don't miss it. You may need to see people where all you do, girl, you want to go out for a drink? Girl, you want, in moderation, you want to go out and see a show? It may be theme-based. This person you don't do anything with except to go to events.
Yeah.
That is the status of your relationship, and that is okay.
Yeah.
Right? Having people at multiple tiers is what I would say consists of that consortium of relationships.
Okay.
Not everybody you have to go and talk about deep stuff with. That's necessary, but not sufficient.
That would be exhausting if you had to.
Oh my God.
Could
right?
you imagine like being in the Rouses and like you're just chatting with the cashier?
Babe, you just want to meet somebody to go take a cooking class with.
Right.
Meetup is one that I typically recommend for people. You're meeting with people, not to meet to talk, but to meet to do an activity with. So you might have that person, I'm looking for, this my foodie friend. We just go and try different foods and talk about the foods. That's all okay. They may never get to the inner circle, but they may never be out. They're on the ring that's appropriate for them and the status of your relationship.
I like
so
that
people
so much.
build that status, that tier, whatever you want to call that bullseye of multiple people in multiple places for you.
Cool.
Okay.
Love it. All right. This is an interesting one. When you begin therapy for all of your past trauma, can your depression worsen?
Right. If we're thinking about trauma-focused therapy, like cognitive processing therapy, prolonged exposure, or even distress tolerance, yes.
Okay.
Simply because you're beginning to process the trauma. When you're beginning, because you've avoided it. Essentially, if you're here, you've avoided it in some way. Cognitive avoidance, emotional avoidance, or actual physical proximal avoidance. So when you start off, the symptoms are low because you're avoiding. When you're talking about them, they go up. We want them to. And then they come down.
Okay.
Right? So stick with it. Hold on and use your stress and distress management techniques while you're in trauma-focused treatment. Because it will come up simply because you're talking about it, but they will go down eventually. And that's how you know it's doing what it's supposed to do. Now you have better handle on the symptoms. They don't have a handle on you.
Nice. Okay. How does one deal with anger issues?
Anger is a low-hanging fruit of emotion. Typically, unless it's like pure anger where you're just 100, there's generally something under there. So I would explore if it's true anger. There are anger management classes. There's actually one in our Ochsner General Psychiatry department. But if it's not the true anger that's driven by chemicals, that's driven by a medical condition, circumstances, there may be something under there. Anger is a blanket emotion. It could be that, or it could be something else like hurt, fear, anxiety, discouragement, loneliness, right?
Okay. So figure out the root. Probably
yeah, if there's a root, figure it out.
Yeah.
And if you're going through, like I've been through anger management, it's not working, something else may be there.
Yeah. Okay. What are some tips for establishing a daily routine that supports your wellness goals?
We have an episode about that.
We do. We'll link it in show notes.
We have that. But typically, it's starting small, right? We think of them as SMART goal setting. Simple, small things can make a big impact. Making sure you're eating regularly, you're sleeping regularly, and you're taking mini breaks. If you're at work for an 8-hour period, you need a break, right? Yeah. Legally, they have to give you 2 15s and a 30 or an hour, right? Break. Not eating in front of your desk or computer, actually enjoying the meal, taking a walk after work. Sometimes people just sit in the car before they go in and decompress for 20 minutes. That's acceptable too. But using a SMART techniques and starting one thing, small thing at a time.
Okay. How do you manage stress and increase focus?
That's loaded too. We got an episode on that one.
We do. We have an episode actually for a lot of these questions.
So self-care is the episode that I would direct you to in terms of stress management. Keeping focus can be an after effect of anxiety or depression. You can't focus if your mind is always clouded with something else. You also can't focus if you don't know how to say no and there are too many things going on at once. Multitasking is just a way to divide the percentage. You can't ever give 100% to any one thing. You
told me this in one of our episodes. You were like, please stop trying to do 12 things at once. And I, of course, was like, no. And you said, you have to. And that does help increase your focus because you can't.
Your brain can't do it.
No. And then you're overwhelmed. And then I still am struggling with this, but I just like stare at a wall for like 10 minutes. And I'm like, what am I doing? You know?
Leave the room if you do that. Okay. But simply put, like the way the brain works, you ever listen to a song and can't think of another song or the lyrics? Your brain can't manage, and that's interference. Something will interfere, right? So you have to go back and let the song finish or turn the song off and to give your brain time to reorient. It's a brain thing. It's not a you thing, people. It's a brain thing. It's an everybody thing.
Something I want to talk about in a future episode, so stay tuned, is the constant not being able to let your brain rest. I think that would be something interesting to talk about. Just like the constant absorbing media, content, and then when we do finally have, for me, it can feel overwhelming, but we can talk about that.
To be in a solid space. Okay.
Yeah, cool. Totally. Okay. This one's heavy too. How do you deal with anxiety around death, since death is a reality for all of us?
Stay in the moment.
Stay in the moment.
Stay in the moment. Being anxious about what's to come doesn't help you now. Does really worrying about dying help you right now? No. Or what you do right now for yourself in terms of your well-being really dictates tomorrow. If I'm thinking, gosh, I deal with it all the time with cancer population. What if my cancer comes back? Well, what are you doing today to prevent that? You're doing everything you need to do and live. 3 years will go by and you've been worrying about death as opposed to just living. So stay in the moment.
Yeah. Okay.
How to stay in the moment might need to be broken down, but
we'll have an episode. We'll have an episode on that. Is it healthy to develop NRE, which is an acronym for New Relationship Energy? Is it healthy to develop NRE from a parasocial relationship from someone who has shown no interest?
That sounds really ticky-tacky. Not to tell me what that means.
So I would assume that this means, is it healthy to
like feel like it's a new relationship with someone who doesn't
observing
and they don't reciprocate? It's also called unrequited love. right? It's the mismatch of when you feel something so strongly for someone and you're continuing to pursue and they don't feel the same. Take caution, that can turn into stalking.
Okay. So it's not healthy.
So it's not healthy unless you haven't expressed it.
Yeah.
If you've expressed your feelings and emotionality for this person and they've told you, I'm not interested, or they haven't given you an indication that they're interested, then just back away, because it's not going to work. They don't deserve you. Move on. Or if you've expressed that and they say no and you're constantly pursuing them, now they're pushing you away. That's not going to get them, you saturating them and overbombing them with love and emotion and contact. It's not going to get them to change their mind because of the unrequited or mismatched nature of the feelings. Move on.
Yes. Move on. I like it. Okay. What are some practical ways to alleviate irrational fears?
Practical ways is talking through the fears. I can't say that all fears are irrational. Some are very real. I work in a cancer population, right? So some people have a healthy and legitimate fear of cancer returning. Talk through the what if. Anxiety has an interesting way about taking you to the edge and making you think of the what if. Answer your question. What if I get cancer again? What if you get it again? You're going to do everything you need to do, right? What if I get into a car accident? Or you're going to pull over? You're going to exchange insurances, make a police report, and you're going to carry about your way. Answer the what if question. What if I never meet anyone? Well, if I never meet anyone, I'll be okay. And I'm going to do everything I can now to ensure that I put myself in opportunity, in spaces to meet people, because you can't meet the burglar at home in your bed in your jammies, right? So think of that forethought in solving your own problem anyways. Another way to deal irrational fears is thinking about where it's coming from. Is it 100% true? Or is it just the saliva of your mind coming out in thoughts and tricking you and lying to you? Thoughts or opinions of the mind, they're not facts. Simply because you think it doesn't mean it's true.
Saliva of your mind. Tell us more.
Your mouth produces saliva for various reasons. That's because it's supposed to. You spit it out or swallow it down.
Since the same with thoughts.
Your mind produces thoughts because it's supposed to. The context and nature of the thoughts can come from anywhere. You can spit them out, let them go, or hold on to them. It's your choice.
Yeah.
Doesn't mean that they're true.
Right. Okay.
Just because you have saliva here doesn't mean you let your mouth fill up with spit.
Either get rid of that thought or...
You're right. Let it go. Not get rid of it.
Let it go.
Just let it come, let it go. Because when you get rid of it, it's going to come back strong. It may come again.
Yeah.
You say, all right, thought. You will lie. Saliva.
You are saliva.
And spit it out.
Just get rid of it. Okay. Last question. Last question. So this person wants to hear more information about an ADHD diagnosis and an OCD diagnosis in women, and how that's different than in men.
So ADHD is attention deficit hyperactivity disorder, comprised of inattention, so your inability to maintain focus, concentration, completing tasks, and the hyperactive, the physical, just can't quite get together. Also with impulsivity, or a combination thereof. OCD is obsessive compulsive disorder. You have an obsessive thought and need to do something to relieve that obsessive thought. Both impact your daily functioning, but they are quite different. They're treated quite differently. They're assessed differently. So I would think if, and females, they can express in various different ways. I would say it's more of an ADHD child-adult, and in OCD, the nature of it. The prevalence in male and female are different, but if you're thinking you have one of these, you have to get assessed for it. Don't self-diagnose.
Definitely, yeah. And I know that different diagnoses and health conditions can manifest differently in women than in men. And a lot of the times we do see, the more male-focused symptoms.
Like depression, for example.
Yeah.
It can come out in males as more of the irritability, the lack of doing things, concentration issues. It can look differently. depression laying in the bed crying all the time. It can look differently, but that's not to say it's a stark difference. You can still have a person assigned female at birth still exhibiting irritability that's symptomatic or quintessential to a person assigned male at birth. So get assessed and see, because it looks differently, and simply because you have a tendency doesn't mean you have a disorder.
Right.
Simply because you have focus issues does not mean you have ADHD. ADHD can look quite like anxiety. Simply because you have a preference for things doesn't necessarily mean you have obsessive compulsive disorder.
Okay.
Okay.
All right. Well, thank you so much for sharing your expertise with us, Dr. Murray. Thank you so much for joining us on this episode of Healthy State of Mind. Remember that this is not meant to act as a therapeutic relationship, and it's best to seek out professional help if you need it. You can also check out all of our resources in the show notes or at www.ochsner.org/HSOM, which stands for Healthy State of Mind. Thank you for joining us, and we'll see you next time.